Science is and has been always a collaborative effort, and it proceeds best when people are not impeded by national borders. Uh, we've had a great cooperation in scientific publications all over the world. World got a rapid head start with the publication from China with the sequence of the virus. That's one of the reasons we have potent vaccines so quickly, and we've got to keep up that collaboration. There are three or four real centers of scientific innovation: the United States, Europe, and China. I would say if you add Japan to that, you've got about 90% of the world's productivity in science. And we need every little bit of information, every little bit of progress we can get to help confront what's turning out to be a far more difficult task: control of COVID. I've come to the conclusion that no single modality is going to put the genie back in the bottle. Vaccines are good, but some of the variants are breaking the vaccines, infecting and sickening people who've been doubly vaccinated, even with the very best vaccines. Public health control. There's nobody who's done it better in China, yet they're so busy at whacking the moles as they pop up from other places all over the world that even the best public health, with rigorous identification, contact tracing, massive testing, and isolation, isn't controlling it in a way that makes life go back to normal. And then finally, with drugs, we know that prophylactic drugs, that is, if you're exposed, you will get the drug, will work and will protect you even if you're infected before you know it. But we have far too few of those. The only ones we have right now that work well are monoclonal antibodies. And unfortunately, when the virus becomes resistant to vaccines, it often becomes resistant to the monoclonal antibodies. We need a global, full-bore effort to do more research. Now, I'm a virologist, and I study these viruses in great detail. We've been very successful at controlling HIV, even though we don't have a vaccine. That's because we have prophylactic drugs. But it took us years and years of intense research. We in America, just in the government, spent $3 billion a year, and our pharmaceutical industry spent just as much for 35 years to get where we are today. We need to catch up. We need the whole world working together to create new ways to treat and prevent this disease. And we need better vaccines. The vaccines we have now, as good as they are, and they're as good as we've seen, fade over time and don't protect against all of the variants and the variants to come. So we really need global cooperation, global effort, and it has to be even more intense than it's been in the past.